Hey everyone, and welcome back to the Hair Loss Show. Russell, good to see you.
Good to see you, Vikram.
Okay, so this is, I've got to say, this is the heart sink one for me, right? So, and for a number of different reasons. Today we're going to talk about how we manage hair loss in a young gentleman, and we've picked 18-year-old. But if I see someone that's losing hair at such a young age, I automatically understand. You feel for that individual because it must be absolutely devastating. They're going through that adolescent phase and all the social implications of losing hair and how it must feel for that individual. But you also, there is that aspect of things. But you also have to understand from our perspective, we can also see absolute desperation in some of these, in some of these patients' eyes.
Incredibly desperate.
Yes.
They are very, very depressed. Some of them are, you'd be worried about,
Of course.
Suicidal ideation.
And a lot of them as well will come in with family members that have also bought into the concept, and rightly so. I mean, I understand. I mean, you and I are both parents, so you want to do everything to protect or help your child. And if this is you want to come and see someone who does hair transplant, that may be the option to.
So the irony is when
you almost feel like you're ganged upon. So there
Sure.
becomes a pressure from that
when
perspective.
mum comes in or dad comes in and he's wearing a baseball cap, which you won't take off unless you ask,
Yes.
My heart sinks. And the parents inevitably think the solution is a hair transplant.
Yes.
They don't come in to talk about medication. They come in to talk about a hair transplant.
So, again, this, automatically we know, I can say this, that when we're dealing with that patient, we know that it's going to take a lot. This conversation is going to go on for quite a while. It is not a quick consultation. It's not here, this is the plan and this is what we're going to do, boom, boom, boom. It takes a lot to unpack what the issues are, and almost try and reprogram what the individual patient is feeling, what their thought process, because generally speaking, they've come in with a set of ideals of what they want the outcome to be. And generally speaking, they want to have surgery because they feel, they've seen pictures that this is going to be the panacea to all their problems.
And their parents want a happy child again.
Of course.
And so this is the issue that the consultation is just as much about educating the parents as it is about educating the child, the young man. So, I mean, clearly, the way I started is a discussion of the biology of baldness and the genetics of baldness. If the father's there and he's got quite a bit of baldness, that certainly helps in a visual way to explain what the future looks like. But you don't always see that. I like to then talk about the medical options and how about we're better at preventing hair loss than we are at regrowing it in most of our patients, and how this is a genetic issue. This is not something that you're going to take a 2-week course of antibiotics to deal with. This is something you're going to have to deal with for the rest of your life. And then the discussion around medication comes to people saying, yeah, okay, but do I have to take medication for the rest of my life? And the answer I give them is no, you have to take medication until you stop caring. And we'll come back to that point because it's really important in young men. You only have to take medication as long as you care. But if you stop the medication, then, and you go bald as nature intended and you're okay about it, then we haven't done any harm. But once we operate, the potential for harm in these people is very great, because once we operate, further hair loss, whether they don't take the meds for the rest of their life or whether they do take them and they're not 100% effective, which we have nothing that we can guarantee is 100% effective, then they're going to bald unnaturally. And that's going to leave consequences. So this is a very, very big issue. And I'll tell that quick story now about what I just said to you. Patient came to you this week. I'd seen him at the age of 18, begging me for hair transplant. I put him on medication, said no. Came back to me at 19, begging me for hair transplant. I said no. I warned him about the consequences of this. Came back at 20, begging me for a transplant, still on medication, and he seemed to be, under control at that stage. So I reluctantly agreed to do it. Then I don't see him for 8 years, and he comes back in a couple of weeks ago with isolated grafts out here and balding in behind as he's receded back behind the grafts. And I said to him, oh, I said, do you want to top up? He said, well, not really. I don't think I do. He said, I just don't care anymore. You know, I don't realise, I don't know why I went through with this because I don't care anymore. And now it's just like, well, this looks wrong. And I said, did I not warn you numerous times 10 years ago that this would happen? And he said, you did. You said it to me. I don't blame you. He said, I don't know. I must have been having crazy thoughts, you know, at the time, because back then I really cared about it, and I was devastated, and I twisted your arm. Now I don't. So I don't blame you because you really did warn me this would happen. And so I said, well, what do you want to do? He said, well, I don't know what I want to do, but I really just don't care anymore. I said, well, you either can cut them out, you can laser them out, or we have to graft in behind and reconnect it. You go back on meds, because obviously he'd stopped his meds as well, you know, because he doesn't care anymore. So I had this real sinking feeling in my chest that because I thought I was trying to help this young man, I ended up harming him. And, you know, the first rule of medicine is do no harm. Right? And so I felt really, really devastated about it as well. I went home and told my wife that I was feeling really low about it because this is something that an experienced person like me, shouldn't have to have happen in their practice. I mean, I can understand why new surgeons in the field, you know, might have a problem, but I'm an experienced practitioner, and this shouldn't have happened to me. But my willingness to help him and think that he was going to be a lifelong patient because he was so committed to the idea of taking his meds and he was so desperate.
And I think that speaks to the immense pressure that sometimes, you know, when we're sitting in the chair, when we're faced with someone who's, you know, emotional, and you can see their pain, and they've come in with support that of what they want. There's a lot of pressure to try and help them or do what do your best for them.
And you're treating mum sometimes as well.
Agreed. It's interesting. I mean, we're going off topic here, but there's recently Jeff Bezos was interviewed by Lex Friedman. You know Lex Friedman? He's I think MIT. But he made a very interesting point. He said one of the things as a CEO you've got to be able to do is to really think through these one-way door decisions. So, you know, most decisions are two-way doors. So if you go down that road, you can always sort of go, oh, you know what, it didn't work out. I'll come back out. But if you go through these, if you're faced with a one-way door decision, you've really got to think it through, because once you've gone through that, I mean, it can be immensely, there's no going back, or it's immensely difficult, immensely expensive to do that. So they got to really make sure. And I think, and I heard that, and I was like, this is one of those, you know, this is a one-way door decision. You've really got to, you know, if you're suffering from hair loss at a young age, hair transplant is probably, you know, firmly at the bottom of the list. You've got to try and optimize everything else. Try and push that decision out as much as possible. You're not closing the door to that decision in the future, but if you do walk through that, then you're committing yourself.
And we need to also understand that, you know, that teenage men, or even to their early 20s, can be very emotional, very impulsive. They do risk-taking behaviours, and they don't think through the consequences of their actions. And so, you know, we've got to protect them against themselves as much as protect ourselves. And so I think that it's a difficult conversation to say no to someone who's desperate. That requires, you know, a certain strength to it.
Yes.
But I think it's the education of the patient that's critical here. If you just say to someone who comes in that situation no, he'll go somewhere else. And that may still happen anyway.
That's the challenge, because you know what? For every one of you that will say no, there'll be 50 other people that will say yes.
Well, I had another one that I said no to at 18. I said no to at 19, and he came back to me sheepishly at 21 with transplants in the front that didn't look good, and he'd been to St Elsewhere's because, you know, I wouldn't operate on him. And now my hand is forced. He's through that one-way door. What am I doing?
Yes.
Right, I've got to fix it now at 21, whereas I was hoping not to have to touch him for a long while. And it's not, you know, you've got to understand our perspective here. We're not scared from personally about us saying no to someone and them going to a competitor. That's not what we're talking about here. What we're talking about is there are plenty of people out there who would take him on.
Yes, because it's a quick quick sale.
Fix, and that's what he wants, you know. And if you think of this as he's a customer and this is what he wants, and I'll give him this product, then that's what happens, and then you get to deal with the consequences of that somewhere down the track. So we have great empathy, we have great sympathy, but it's about educating these young men. And if you're a parent listening to this who has children with hair loss, please be aware that this is a very complex situation in a young person. And even though it's devastating psychologically, the fact is if we can start a treatment process for them that's not going to harm them, right, with low-dose medications, this is usually what the situation is, and they can see stabilisation or after 6 or 12 months a bit of improvement, that has a dramatic effect upon their psyche. We just can't fix it overnight. Nothing happens overnight. You've got to be with us on the journey.
Do you remember, again, a couple of months ago, I put up a poll on and I think you sort of entered that as well, about this topic on who would operate. And so this is a WhatsApp group that we're part of, and it's full of doctors from all over the world asking a similar sort of question. The results were not clear-cut. No. There is a variety of responses and opinions, and so I think majority of people feel that, okay, look, operating in a younger individual. I think the example I put on was a 21-year-old, but even still, I think the viewpoint it's varied, and people will try and make a justification, you know, and I understand the arguments across the board. So we are quite conservative, but we're conservative for a reason. And you've seen, and I've also seen patients that have come back, and it's the heart sink one when they go, I've done this in the past, and I wish I hadn't done it. And you go, well,
that's even if it's a good result. So you've got a technical and a cosmetic result from the operation that was quite good at the time, but it just hasn't aged well because of the expansion of the baldness. So I think the take-home message is that we have better options now in our younger men to manage them than used to be the case. When I started in the field, there were no medications, so a transplant was the only option. And so maybe you were a bit more tempted because there was no alternative. But now we have good alternatives to offer these young men and their families. And that's what we need to explore first. And I try not to talk about the transplant in the first consult much at all, other than to say this could be a bad idea. I want you to focus on what I'm telling you now. There's only so much information they're going to take in on a first consultation.
Yes, because usually saying no is throwing them off their perch, so to speak, in the sense that they weren't expecting someone to say no. So it's having to walk them through what the options are. So I think we've gone down a little bit of a rabbit hole, because I think the fundamental thing, probably the take-home message that we want to give you, is that if you are in the sort of category where you're a young adult losing hair, you've got to think through your options. Make sure you get assessed properly, that you've got a long-term view of what potentially could happen, what the treatment options are, and really try and delay surgery as much as possible.
And if you're a parent of one of those people who are watching this, because a lot of parents do their research like this, then understand why it's not as simple as we'll go in there and we'll talk to a hair transplant doctor and get a hair transplant.
Yes.
It's not that simple an equation. This is going to be a complicated management that has to be done over a period of time and requires very careful thought. And you have to be an advocate for your child as well as us being an advocate for that person, to make sure that we're doing the right thing in the long term rather than the instant fix that everybody wants. We want the problem solved yesterday.
We obviously feel very strongly about this.
Indeed.
On that note, thank you again for watching. I hope you have enjoyed that, and please remember to like and subscribe to the channel, and we'll see you on the next episode.
Thanks, everyone.